So, hello everyone. This is a session by Doc Tutorials to help you orient yourself better for your branch selection. And in this episode, we are dealing with medicine and pediatrics. So often students have got confusion whether to go for medicine and or whether they should go for pediatrics. Obviously, there are reasons for this confusion, and we hope that we can at least solve a few of those queries and confusions in this session. So this will be a dual faculty session. Myself, Dr. Rahul Rajeev, Medicine faculty of Doc Tutorials, and we'll also be soon joined by Dr. Sandeep Sharma sir, who is the Pediatrics faculty of Doc Tutorials. So basically, in this session, we are going to talk about our personal opinions. So you can listen to this, and hopefully this will help you go for the best choice that you like, because branch selection is finally one's own choice, and I'm sure that you are your own best judge. So I'll start off with the medicine segment, and we'll be soon joined by Sandeep Sharma sir as well. So first of all, let me tell you, this is going to be a very short session wherein we'll try to address the most commonly asked queries. You can ask any queries that you have in the chat box as well. We'll be happy to answer those questions. So I think I'll start off. First of all, regarding my branch, general medicine, one query that I got from students is, sir, why did you choose general medicine? Or who should choose general medicine? So in my case, I had an interest in general medicine right from the time of my MBBS days. I was so fascinated with the art of history taking and reaching a diagnosis and instituting the appropriate treatment. So this whole process actually fascinated me. And many a times coming to a diagnosis seemed like a jigsaw puzzle. And seeing a few of my consultants in medicine, I got inspired to take general medicine. So in my case, I had no confusions that I was aiming for general medicine. At the same time, I understand that, see, we all as students, you all will be having certain apprehensions in your mind. So I'll try to solve a few apprehensions. So first of all, common query, sir, medicine, lots to learn. Should I be going for that branch? So first of all, lots to learn is not just for medicine, even for apparently what is a minor subject for your entrance exams, dermatology, you have considerable theory to learn. So please understand that for clinical subjects, learning is not just about reading, reading, and reading. Obviously, reading is important. You have got to gain knowledge, but eventually the knowledge that you gain has to be translated into actual patient practice. Now, if you are trained in a good hospital where you get good patient exposure, you will be able to translate this better into practice. Training that you receive from your faculties, you will definitely be a better version of yourself with each passing day. So what I would tell you is, once you take the branch of general medicine, you're probably going to enjoy the process. Now, do not worry regarding the huge amount of probable syllabus that you have got to cover. As I said, the journey is beautiful and you can definitely, take it as a branch for life. Now, next query by the students is, sir, I have got so-and-so rank. I am not getting MD medicine. Probably I might get DNB medicine. Should I take DNB medicine or should I go for MD pediatrics, which I'm getting at my rank? Many students have messaged me the same query. Now remember, if medicine is your first preference, in that case, always prefer the branch over the degree. because you can very well take DNB medicine. You can get trained in a good hospital and you can evolve as a better physician. And still the doors of super specialization will be open for you and you can become the super specialist that you want to be. At the same time, if you want to remain as a physician, you can still do it. Well, there is a trend of super specialization, but if you are that passionate enough to be in medicine, you can definitely contribute to, your patients, and you will have enough job opportunities as well. So that is my second point on candidates who are confused between DNB medicine and MD pediatrics, provided your first love is medicine. Third query by many students, sir, is super specialization mandatory for general medicine? Well, I've just told you that point, that in case of general medicine, yes, there is a trend towards super specialization because the health system in the country is in such a way that if I want to see a neurologist today, I can do it. If I want to see a cardiologist, I can do it. So which means for any minor ailments, people now tend to prefer super specialist. For a headache, they want to visit a neurologist, not even a physician. For any sort of GI symptoms, they want to visit a gastroenterologist over a physician. But the trend is not the same across all areas. You will still find many areas where physicians are running very good practice, often, multiples that of probably a super specialist in that region. So let's put it in this way, that super specialization looks like a trend, but still, again, if you have got the passion, you can still excel in this branch. Next is the query for saturation. Is medicine saturated? Is neurology saturated? Is cardiology saturated? I wanted to be a cardiologist, but I'm hearing that people all around say that cardiology is super saturated. So should I take medicine? Or, since the saturation issue is there, should I refrain from taking medicine? Well, first of all, my opinion is that there is no saturation as such for the branch. Saturation is regional, by which I mean, see, suppose if I have done MD medicine from so-and-so institute, once I have finished MD and I am looking for a job opportunity, there is a possibility that in my locality, there are enough physicians so that maybe the hospitals there are not looking for maybe other physicians. But still, I'll get an opportunity, maybe in a hospital that is, say, 1 hour journey from my place. So the only issue is there can be regional saturation. The branch as such doesn't get saturated. You will have opportunities. The same goes with super specialization. Let me quote an example from my own life. After I had done DM in neurology from GMC Trivandrum, well, I had observed that in most of the hospitals in and around my locality, they already had a neurologist. But again, there came a vacancy in one of the hospitals, which was not so far from my home. So I took that opportunity. But the issue here is there is no scenario where a neurologist or a cardiologist or a physician sits at home jobless just because of this saturation phenomenon. There is no such phenomenon is what I want to tell you. Regionally, you can have saturation. These are my initial points, the initial 4-5 questions which students often ask me. We are joined by Sandeep Sharma sir, who is an eminent pediatrician and also the leading pediatrics faculty in the country. So sir will also be sharing his insights. He has done his MD pediatrics from PGI Chandigarh. So I'll ask him his initial inputs. Sir, first of all, welcome.
Thank you so much, Dr. Rahul. I hope I'm visible and audible. And
Yes.
A very good evening to all the students who are joining it here. I'm really sorry I could join just at now because I had some prior commitments and I got stuck up in the Delhi traffic. So I've just reached the hotel and I'm joining here. So I was listening intently to whatever Dr. Rahul was discussing with you. And I can't agree more that if you have an option and if you want to take MD medicine, you should always be going for MD medicine. If it is not MD medicine, the branch is very important. If you're not getting MD medicine, instead of jumping the ship, go for DNB medicine. There is always a place. You can always find your way later. So the branch is more important. Having said that, there are always a group of students. See, I want to look at it from a different perspective. There are three categories of students when we talk about medicine and pediatrics. There are a few students who are sure they are going to take medicine wherever they get, howsoever they get. So those students will they can benefit from listening to it. They can have an opinion, but this session they will not have any kind of doubts in their mind. Second category of students are those who always wanted to be a pediatrician and they have joined MD. They are going to join pediatrics. There is a third group of big students who are not sure about whether they should be joining medicine or they should be joining pediatrics. So here, let me first share about the perspective on from a pediatrician point of view. MD pediatrics is like a medicine for the child, but at the same time, it's a branch. Unlike medicine, yes, the trend is towards super specialization, but still there are enough number of people, especially in smaller towns, who tend to do only MD medicine and go into practice. Let us be honest, when you join MD pediatrics, your 3 years are going to be very, very hectic, just like it is going to be in medicine. So don't expect any freebies just because cute faces are there. Second thing, you will be dealing with all these subspecialties in pediatrics, and pediatrics is, after medicine and surgery, it has the highest number of super specialty seats and subspecialization seats as well. So it is as complex and as widespread and as complicated as you want it to be. Another thing to notice is pediatrics versus medicine. There are a few areas. If you think that pediatrics is going to be having a as wide a base as medicine, the answer is no. Medicine has a wider base for the simple reason medicine deals with people from 18 to 80 years. Pediatrics deal with patients from 0 to 18 years. So that is one difference. Second difference is, yes, you are not going to be devoid of the patient, but at the same time, pediatrics in most of the metropolitan cities, it is saturated. So Rahul rightly said that it depends upon the place. And if you want to be a general pediatrician, then places like Delhi, Mumbai, even Chennai, even Chandigarh, even Ahmedabad, they are hugely saturated. So you will take time to get settled. If super specialization fascinates you, then you can always go for super specialization. Earlier, maybe 10 years earlier, there used to be just 2 or 3 super specialization. Right now, there is DM neonatology, DM pediatric gastroenterology, pediatric cardiology, pediatric nephrology, pediatric rheumatology, pediatric critical care, pediatric medical genetics, and there are also some fellowships available. So you have almost 10 to 12 specialties. There is oncology and hematology separately for pediatrics as well. So if you want to be a super specialist, that field is there. Third thing, pediatrics gives you that flexibility. What do I mean by flexibility? Tomorrow you want to be a general pediatrician, you can. Tomorrow you want to decide about doing super specialization, there is a NEET SS exam. You can sit in that, do super specialization in pediatrics, work in a corporate hospital, or maybe have a institutional or a small private practice. You want to uh, do only fellowship and not waste 3 years doing. There are 1 year and 2 year fellowships and observerships available for particular specialties. Fourth, you are tired of pediatrics. You don't like kids anymore. It may happen. And you want to jump the ship. I would not suggest that you take pediatrics and jump the ship. But if you decide that, then at least in the central institutes and a few places, you can sit for the super specialty exam of adult medical branches as well. Having said that, now through NEET SS, you need to sit in the medicine exam, not in the pediatric exam. So if you are thinking that you wanted to be an adult cardiologist and you will first do MD pediatrics and then join DM adult cardiology, the path is there, but it is going to be very, very difficult. Because now NEET SS says, after doing your MD pediatrics, you will have to, if you want to be a cardiologist, you can, but you will have to sit in the MD medicine exam. And the questions will be from Harrison, they will not be from Nelson. So are you willing to take that path? I would ask you to think twice. Pediatrics as a branch, it is very satisfying branch. There will be pressures because you're dealing with young kids, but end of the day, bringing smile to a to a sick child, it is very, very satisfying. At the same time, when you attend deliveries and handling a newborn is something only a pediatrician can do. General physicians usually refrain from touching a child less than school going age. Let me be honest. Yes, they can give medications for some sore throat or some basic medications about diarrhea. When it comes to a newborn, when it comes to a young child, you will have complete monopoly about the areas. You need to be associated with nursing homes. You need to be associated with multiple places rather than working at one place. So you need to be freelancing a bit if you are into practice. First 3 years will be tough. It will be as tough as medicine, not more, not less. After that, you will have a choice: pediatrics practice, general pediatrics in an institution, general pediatrics as a consultant or senior resident. Those options are there. Super specialization, sub specialization as a fellowship or as a observership, or simply last resort, decide about maybe practicing as a medicine person. Adolescent medicine you can practice, and probably think about some medical branches as a DM, but that would be the last option. So these are the options available to you. Over to you, Dr. Rahul, and your feedback and your comments on whatever I just shared.
Yes, sir, I completely agree with you, whatever you have said regarding the prospects of pediatrics as well as further ramifications and opportunities. Sir, one query that I got from students, which I would like to discuss with all of you is, some students tell me, sir, I have an inclination for medicine and pediatrics. Obviously, I'm talking about the third group of students Sandeep sir has just said. Sir, but still, if I want to make a choice, how do I make in terms of job prospects and salary? See, first of all, understand that job prospects are there for every branch. I'm not just telling about medicine, pediatrics, anesthesia. See, job prospects are there. You will have opportunities. So it's you cannot make a decision. Okay, I cannot make a statement like medicine has more job prospect than pediatrics or vice versa. And similarly for other branches as well. If you are decently good in what you are doing, you will always have opportunities, and you will always have opportunities to go higher up in the ladder as well. The thing is that please take an institute where your training is pretty decent. Now, this is very, very important. So I think you should be very cautious on selecting a college for, your post-graduation as well. So basically, starting or answering that question, job prospects and salary, it's good. And not all physicians earn the same. It depends on which place you want to work and whether you want to work in multiple hospitals, what sort of a lifestyle would you like. So it depends on multiple factors. So it's all about, liking a branch and seeing the future in that branch for yourself and then going ahead with it. And the third group of students confused between medicine and pediatrics, let me tell you, you are not going to be 100% certain on your choice. Well, you will think over it again and again and again. And finally, you might actually come to a decision. Okay, maybe this branch seems better for me. But there is a chance that still you are in doubt. You've got a slight doubt. Suppose you're almost convinced about medicine, but then again, you think, should it be pediatrics? So the thing here is, you make a decision and it is up to you to prove that decision was the right one. Get trained in an institute very well. Be sincere in what you're doing. You will obviously become good in what you're doing. That's what I want to tell you. Sandeep, sir?
Absolutely, Dr. Rahul. I think it all comes down to individual preference as well as individual choice. But try to join a place where you get enough patient exposure and where enough training facilities are there. Because, see, one aspect is important. You do MD either in medicine or pediatrics, but you don't know about the subject and you haven't seen the patient. So that again is going to be a bit of a problem with you later on. Of course, you can always do SR shape and work at a few places and equip yourself better, but it is always preferable that you also take into account institution. But if it finally comes to institution versus the branch, then you should go with the branch. Now, regarding job prospects and all, there are a lot of people who tend to ask, sir, how earning pediatrics is. I'll not talk about medicine. I'm not qualified to talk about it. Dr. Rahul is the best person for that. If you talk about general pediatrics, it's not like radiology. It's not like surgery. end of the day, it's a physician-oriented branch, consultation-related branch. So your money will be gradual. It will come. Trust me, it will come. But it will not be like suddenly in 2 years you are going to buy a BMW by your practice. That is not going to happen because uh, it is not a procedure-based branch. Fast money comes where it is a procedure, like a dermatology, working in a cosmetology center. Even a general dermatologist does not make that fast of a money. Uh, Similarly, money again comes down to the place you are working in. If you are working in a government setup, whether you are MD Medicine, MD Pediatrics, MD Derma, MD Microbiology, MD Anatomy, you are going to have the same salary, right? Let us be clear. If you are into government service, government medical college, private college, generally it is going to be the same. If you are planning to go into private practice, starting salary for corporates, except for branches like radio diagnosis and DM people, the general starting salary is almost identical. If they need somebody, as a uh, immediately chahiye, so obviously they will be paying more, but generally the starting salary is same. It will depend upon the place. It will depend upon the city rather than what kind of MD or MS person you are. Thirdly, coming to career prospects, it is always advisable that if you are doing a private practice, try to do specialization or try to at least do a fellowship or become expert in something. I'll give you an example, an area people tend to ignore. If you are a general pediatrician, starting your own practice, you may first few months or maybe a year, you may find it difficult to even break even or pay your bills. But if you also are well versed in IQ testing, developmental testing, and you are well organized and collaborating with many gynecologists, you will be making good money from attending the uh, deliveries. Then the same patient you have delivered will be coming to you for the vaccination. So work ethically, but there is enough margin in the vaccines, even in private setup. And along with that, these children will be getting sick, and you will have dedicated patients available to you. So it is ABC: availability, behavior, and counseling. These three things become very important in pediatrics. So if you are available to your patient, your behavior is good, your counseling skills are great, the patient is going to be there, the parents are going to bring the child for 18 years. And that is how the pediatric practice builds. You become a family pediatrician to them. It will not happen in a day, but slowly, gradually. There will not be a fast peak, there will be a gradual peak, but you will start making money good. In the meanwhile, you start working on developmental assessment. Many pediatricians I know, they are not endocrinologists, but they attend fellowships, they do some workshops and other stuff. They update themselves and they work in the field of pediatric thyroid disorders and pediatric diabetes. India is the diabetic capital of the world. And yes, adult diabetic persons do handle kids, but I know that they are always, shaky when it comes to a young pediatrics patient. So this is one area you can always do OPD based practice. Meanwhile, a few night duties, meanwhile, attending a few deliveries, gradually your practice will pick up. Eventually, it will always pick up, but you need to be, uh, you know, balanced about it. Don't have any notions that you are going to earn fast money. Pediatrics is stable money, boring money, gradual money, good money. But if you are looking for fast money, maybe you are in the wrong field. Medicine doesn't give you fast money unless you are going to go into you're going to have a nursing of your own, or you're going to put up MRI machines of your own, right? So that is my perspective regarding the earning potential. Among DM branches, DM neonatology and DM endocrinology are two branches in which there is a lot of scope. DM neonatology, yes, saturation is there, but if you go to smaller places, there is still a need. DM endocrinology, because India has very few pediatric endocrinologists available. So you go to any corporate, you will have very excellent opportunities available. Branches like neurology and critical care will be limited in scope, to be honest, because you can't work privately. You will have to get associated with institutions. And if you are willing to go to peripheries or smaller towns, you will have excellent opportunities. If you want to settle in Delhi or Mumbai, you'll have to wait, and your high quality job may or may not come immediately to you. So, Dr. Rahul, over to you.
Yeah. And thank you, sir, for those inputs. And just to add on about super specialization in medicine. See, one thing I want to tell you is when you take medicine for a branch, just approach your residency trying to love all, subspecialties. Maybe you're starting your day or your day one in medicine with the dream of becoming a cardiologist. Maybe in your med school, you have always wanted to be a cardiologist. But make sure that you try to like each branch. Because I am a practicing neurologist. At the same time, I have to have a decent knowledge in all branches. Because I'll have cardioembolic strokes, I'll have APLA syndrome, patients with SLE, with secondary APLA, with stroke. So I've got to be good in rheumatology. I'll have vasculitis cases that can present with, neurological manifestations. So when you start your journey as a resident in either MD or DNB, try to give importance to every branch. Even if you have a special liking for a branch, eventually you might go on to take that branch as well. But a base knowledge is very, very important, is what I feel. I always tell my students, this is not something that I have said myself. I've always learned from my teachers as well, that try to become a physician first and then a super specialist later. This will definitely help you in the long run, especially with regards to taking decisions. Remember, when you are a cardiologist or a neurologist, do not narrow yourself to a window where, you just see the heart and nothing else. Okay. So try to see the patient as a whole. That's one point I want to tell you. Second, I think, Sandeep sir, some queries from students regarding, choosing a college, like for, say, medicine as well as pediatrics, because I can see a comment. Can you list down good government colleges in Tamil Nadu? See, what I want to tell you, students, is that, see, we are not here to give you, say, a list, because your list will depend on multiple factors from where you are, multiple factors, I'll just list a few important factors. See, generally, I would like to tell you that when you take a college, when you want to choose a college for medicine residency, obviously this will overlap with pediatrics as well, and we'll get Sandeep sir's input. So let's have a 10-point checklist. Number one, you look at the average number of OP cases in the department. Number two, have a look at the average number of IP cases in the department. Both these will give you the exposure that, an idea of the exposure that you're going to get in that institute. This is very important because you should have a decent exposure to be trained properly. Number three, well-established ICU setup. Many a times you might opt on a college for medicine, but you might find that the ICU setup is not good, which means your department might not be admitting patients who are sick. For handling or for caring patients who are sick, you need a good ICU setup. So you see whether there is a good ICU setup. That's point number three. Point number four, number of residents. Now, this is also very important. If you choose an institute where the number of residents are very less considered to the amount of work that you have got to do, you will have to compromise a lot on your academics. See, doing work is important, academics is important, and a balance between both is important. Just like in your PG entrance preparation days, you had a proper balance between your theory and MCQs. So MCQ practice, similarly, you should have a proper balance between your, academics as well as your ward works. Point number five, number of faculties. Now, this is something I always stress upon. It's always nice to have more faculties in the department. It refines your approach better. Because medicine is a branch wherein, my approach may be different from somebody else's approach. Obviously, there can be overlaps, but it is always nice if you see approaches of different faculties and you can refine and bring out your own approach. But if you have got very limited number of faculties, let's say 2 consultants, well, during your training phase, you are exposed to lesser number of, say, methods of taking a history or approaching a case. So it is always nice, because even during my training days, I was very fascinated, because every time I shift from one unit to another, because every 2 months we are shifted from one unit to another, you get exposed to different methods, that actually refines your perspective also better. Number 6, streamlined academic program. Please inquire with the resident. Because see, if you are asking me, see, I did my MD medicine from GMC Calicut. But at the same time, I would say that if you want to, inquire regarding that particular college, it is always better to inquire with somebody who has recently passed out, or maybe a final year resident or a second year resident, because the dynamics of a department might have changed. Certain faculties might not be there in that position. So the department dynamics changes. It is always nice to talk to someone who has recently passed out, or a second year or a final year. And why did I omit first year? On purpose, because naturally what happens is the first year is usually the most overworked person in the department. And right now, if you call a first year resident and ask him, how is academics here? How are things there? Do I get time to read Harrison? Well, he would be really frustrated, because you might be calling him amidst, a sleepless night. So I think refrain from that, and you ask a second year or a third year resident. Point number 7, super specialty departments. It is always nice to take your medicine in a college with good super specialty support. I said it is good. Why? Because when you are exposed to your super specialty departments, especially during the second year of training, well, again, your perspective changes. In my case, my perspective about neurology changed a lot during my second year of medicine residency, when for 2 months I was posted in the neurology department. So I was fascinated by the type of cases that we saw, the way the consultants were taking the history, their approach, their methodology. So all this would actually refine the perspective. So it is good to have such a college. Then point number 8, established the radiology and lab support. Now, suppose you are in a hospital where there is no CT scan or MRI. Now, in that case, what is going to be your knowledge in stroke management? Literally zero. If you do not have a facility for taking a CT or MRI, so any patient who comes with a suspected stroke, if you are here to refer, remember, you will only be a traffic police. Always remember, you have got to get exposed to maximum type of cases. Point number 9, I would like to stress again, toxicity in the department. So what is this toxicity? See, the environment around you is also important. Stress is everywhere. Stress is everywhere. Any college that you're going to take, first year of residency, maybe even second or third year, you are going to have stressful times. But again, the environment that you're having, which includes your colleagues, your senior consultants, the HOD, at least the environment should be congenial, because you are working for the system. At least make sure that the system is supporting you, so that you will be happy and your mental health will be good. So again, ask a recent pass out, or maybe regarding, a resident there, regarding the overall functioning of the department. So you look at the toxicity. And lastly, point number 10, you talk to your seniors, you talk to multiple people, you listen to us, but finally you have to make a decision, because the choice that you make is dependent on multiple factors. Where you want to, what is the preferred state? Because I usually get queries, sir, can you list down the top medicine departments in India, 1, 2, 3, 4? It's not possible. It depends on multiple factors. In my case, I have my own priorities. In your case, you might have your own priorities, but I would like you to, stick to this checklist in case of medicine. Sandeep, sir, in case of pediatrics, what do you think? If I am asking as a student, if I am asking your help regarding choosing a college, what are the points to be kept in mind?
Dr. Rahul, you have very rightly mentioned most of the points, and many of them, I would say most of them are applicable to pediatrics also. In case of pediatrics, you need to first see the rank and what possibilities you are getting, number 1. Number 2, look at the patient load. Number 3, look at a working pediatric ICU and our working neonatal ICU. Many of the smaller places, many of the private institutions, they do not have a working ICU. And maximally what they will have is a neonatal ICU, which is also a makeshift kind of a thing. So it is always better, if possible, if you're sure that you have 2 or 3 options available and it is your home state, try to do some homework. If possible, visit them and have a look at them, whether they are actually working or they are only on paper. This paper-based thing also is there in the medical colleges. Having a functional ICU and pediatric ICU, PICU, we call it as, and newborn ICU, that is NICU. That is a bare minimum important thing. Also see if there is a ICU, do they ventilate or do they refer? Many of the places, there are no functioning ventilators also. So if you have never seen a ventilator, you can never learn a ventilator by a online program or standing beside it or just looking at it. You need to operate it. And if there are enough number of ventilators available, you will be doing and you will be able to see. Then again, subspecialties. Many pediatric places have subspecialties where fellowships or DMs are available. Those should be preferred. Then again, it comes down to how much of a good toxic or versus non-toxic environment is there. Many of the pediatric places are extremely toxic. I know a few places where some of my colleagues or seniors or people I know personally, they are working. Inside the place, they are totally different human beings. Outside the place, they are totally different human beings. So even my younger self, I would not advise them, knowing fully well that they are excellent people in person. That is the environment of the department. And many times the departments themselves are toxic. I'm not saying, I'm not pointing it out to anyone. I'll just give an example. Suppose you are getting pediatrics in Delhi. You should not even think and take up either of the two branches if the rank allows you, places like MAMC and places like RML. About other places, I will not say they are bad, but the toxicity level keeps on rising in the other places. So at the end of the day, all the places are good. But again, if you have to pick a branch, my choice will be these two places because brand is there, exposure is there, academics is there. In fact, there are two other medical colleges in Delhi where academics are, I would say, 1%, 2% superior. But the toxicity, when I say toxicity, it is not about the person, I repeat, it is about the department per se. So that factor also needs to be taken into account. Also, don't try to talk to first year resident. Why? How is the department? Never talk to a first year resident if you know them. Because first year resident is always stressed out and he or she may give you a false impression. It is better to talk to a second or a third year resident and maybe have a look at the place themselves. And if you can find some inputs, you can always ask your superiors about it. Maybe some other specialty people. Coming to Chennai, Chennai has some excellent places for doing pediatrics. If you are thinking of doing DNB, I would say don't even think. 𝗪𝗏𝗂𝗏𝗃 and Mehta Children Hospital. Excellent places. Mehta Children Hospital. Dr. Shashidharan is there. Very, very strict person. But the way he will teach you, I think very few people will be able to teach like that. At the same time, if you are going to do MD, you can pick up any of the government medical colleges. In fact, ICH is a very good place, excellent teaching environment, and they have fairly okay, I would say, toxicity level, tolerable toxicity level is also there. So ICH should be high on your agenda. Along with that, Madras Medical College, obviously, all departments are good. They are going to be very, very strenuous. Madras Medical College, Stanley, Kilpock. I would personally prefer Kilpock a bit over Stanley, looking at the recent, selection rate in super specialty and other places as well. But I would say that most of the Tamil Nadu medical colleges, Chennai medical colleges are good. They are on the good side compared to the other places in the state or compared to other places. Madurai Medical College, excellent environment. If you are not able to get in Chennai, again, good environment. And outside Chennai, if you're moving again, Kerala, Rahul, Dr. Rahul is the best person. Trivandrum, GMC is finest place. GMC Trivandrum is renowned for giving consistent super specialty toppers in NEET SS pediatric. NEET SS, INISS, there are 4 or 5 places. Every year you get top places. BHU, PGH Chandigarh, AIMS Delhi, GMC Trivandrum, BGMC Ahmedabad, and to a certain extent KGMU as well. And MAMC people, yes, 7. These 7 places, I would say, every year top 10 NEET SS pediatrics, INISS pediatrics, people consistently care because you have a working environment, you have people to train, they give you time to study, and they give you that environment to thrive. So if you're getting any of these places, don't even think. Times are going to be tough. But again, also make a point that it should be a place where a gynae department is also good because neonatal exposure will also. There are a few places. I know a few places. You'd be surprised to know deliveries don't happen. They are either refer it or just almost lead in labor comes, then only they will be taking delivery. So your neonatal exposure is also going to be less in those places. And finally, if there is a pediatric gastro center working or there are endoscopies being done, there is a celiac disease clinic being done, and there are regular epilepsy clinics being done, please prefer those places because that is where a lot of private practice you are going to do in later life. So having that exposure is also very important. Over to you, Rahul sir.
I think, sir, we have discussed most of the commonly asked queries, in this session. And I don't think there are any further questions which we see actively in the chat box. But at the same time, if you're watching this session later, please feel free to ask any queries in the comment section of this YouTube video. You can also reach out to us. I'll be available in Instagram under the ID Dr_Rahul_Rajeev, Rajeev. Okay, repeat, Dr_Rahul_Rajeev. And Sandeep sir, in case they want to reach out through Insta, like your ID, please.
Dr. Dr_Sandeep_Sharma_108. Right? Dr_Sandeep_Sharma_108. I've put a bit of filter, but you will be able to identify. Not so much of filter in the pic. And we are always available. You can also put a comment here and we will be trying to answer once this video goes as a recorded version on the YouTube as well. So we are there to help you out. See, whatever queries we got and whatever things we came to our mind, we have shared here. You might be having some specific queries and you are most welcome to ask about it. About the Bihar colleges and Telangana colleges, people are asking. So Dr. Rahul can tell you better about Telangana medicine if he has an idea. About Telangana places, obviously Osmania has good pediatric exposure when it comes to Hyderabad. And Bihar also, Patna, you should be preferring. Apart from Patna, the other pediatric colleges, I would be honest, not that great. Patna, maybe I think the main medical college is better compared to the other one. And as for DN, in fact, Ranchi is a very good place. If you're not getting a branch or if you're getting a peripheral place, you're getting Ranchi. Ranchi is not that far away from Bihar, so you can always think of Ranchi place as well.
And just one point to add as well. See, suppose if your rank is not giving you enough opportunities for a very good college, which like out of the checklist that we have given. So what I feel is in today's digital world, you've got an opportunity to get exposed to different faculties. For example, during my training, say during DM, I have listened to lectures not just from my department faculties. I have listened to lectures from faculties across the country and across the globe. And how is that? Number one, I visited or I participated in multiple national and international conferences. So once you go to multiple conferences, you get exposed to different faculties. And nowadays, a lot of online webinars also happen where reputed clinicians take lectures. So during your training, please give yourself that opportunity as well. So in case you are missing out on a particular college because of your rank, don't be disheartened. Still, you have got opportunity. But again, in terms of clinical exposure, let's try to, take a college with at least a decent exposure. Okay. Sandeep sir, any last closing comments?
Just a couple of comments. Can we take DCH and do secondary DNB? If you are thinking of taking only DCH, I would say think again. If you are taking DCH, keep in your mind, you have to do secondary DNB. Secondary DNB after DCH will be 2 years. But after doing secondary DNB, you will be at par. You will be eligible for most of the job opportunities as well as for super specialty. But do the secondary DNB from a proper place which has enough beds available. So have a look at the requirements, how many bedded hospital it is needed for the DNB part. But yes, you can. And DCH followed by secondary DNB is another option. Regarding the medical colleges in Maharashtra and Madhya Pradesh, there is a huge list. If you have any specific areas or possibilities, you can always ask us. Generally, 𝗪𝗔𝗵𝗂𝗹 Bhopal is there. There is Indore Medical College also. I would personally prefer Indore Medical College compared to Bhopal. And there is Rajaji's kind of medical college, I think, in Gwalior. That is the okay kind of college. I will not say very good. I will not say very bad. I'm comparing it among the other places. Regarding Maharashtra, obviously Mumbai, you have the so-called, you have KEM, you have Nair Medical College, and you also have the obviously the TNM Medical College and Grants Medical College. Prefer them over the others. And Grants has a very good pediatrics department, so you can definitely consider about it. And even Pune has a good number of medical colleges available. I think DNB Pune has a lot of good options. Even Hinduja Hospital, secondary DNB you can do. If you plan to do DNB, your options should be very clear. Delhi, Mumbai, then you have the down south, a couple of places. If you have the rank for that, if you want to, really do it from a good place and are not scared of the exit exam, so DNB is a good option. In fact, DNB from Gangaram, Delhi, DNB from St. Stephen, Delhi, DNB from 𝗪𝗏𝗂𝗏𝗃, down south, excellent places. I would say better than MD in 95% of the places. So if you are not scared, definitely you can consider those places as well. And Karnataka for pediatrics, again, Niharika, Karnataka is too big. Bangalore Medical College obviously is the best one. If you are thinking, if you have the money, if you want to go, Manipal, pediatrics department, the main Manipal one, not the Mangalore one, but the main Manipal one, excellent department of pediatrics. You get a lot of exposure, but again, finances part you have to take care of. I think covered most places. Baki details, specific things if you want, you can always put up. Because many of the places we have a general idea, vague idea. It's not like I'm going to all medical colleges, I have all the data in front of me. This is based upon what we hear and what we see around us, what students also tell us. So Dr. Rahul, finishing comments from you.
So that's it. We have listed down the answers to most of the questions that you have asked. And we wish you, on behalf of both of us, we are wishing you all the best for your career in both the professional aspect as well as on the personal aspect. Please stay happy in life, stay blessed in life, and that's it. Thank you so much. And please reach out to us for any query that you have got. Thank you so much.
Thank you so much. Do well. God bless everyone. And thank you, Dr. Rahul, for this. Thank you.
Completing the NEET PG syllabus can be challenging. Doc Tutorials presents NEET PG 2025 Live Power Pack. Whether you are at home, college, hostel, or library, our live classes will be right on your screen. Simplify complex topics into easily understandable concepts and prepare all 19 subjects effortlessly with our expert guidance. Our NEET PG 2025 Live Power Pack offers live classes for complete coverage of all 19 subjects, 19 tests and discussions, full access to NEET PG Power Pack, quick revision program, recorded sessions for reference, hard copy workbook-based classes, post-session tests, and grand tests and subject tests. Our eminent faculty. NEET PG 2025 Live Power Pack, bringing classrooms to your doorstep. Enroll now.